Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer. Spring is right around the corner and we'll be eager to get outside and enjoy the longer, warmer days. For many children, this may bring on symptoms of seasonal allergies. These symptoms can be unpleasant and challenging to manage. Today, I'm joined by pediatrician Dr. Bethany Gad to talk about seasonal allergies. We'll identify seasonal allergy symptoms not only in children, but all ages, and discuss warning signs that may need medical care. So stick around if you'd like to learn more. Give us a like to let us know you're watching. Share this video with your friends. And if you have any questions for Dr. God, please leave those in the comments below. So welcome, Dr. God. Thank you for joining us. Before we get started with the questions, could you tell us a little bit about yourself and your background with MedStar Health?
Sure. Thank you for having me. It's good to be here today. And I'm Bethany Gad. I'm a board certified pediatrician. I have been in Southern Maryland, either living or working in Southern Maryland for almost the last 7 years, although I am new to MedStar as of October of this last fall. So it's been good to join the MedStar team. Prior to just working here in Southern Maryland, I was in the Navy. So I was, my last duty station was actually down here at the Pax Naval Station. Prior to that, I was at Walter Reed in Bethesda. And I also spent a couple years on a ship, so taking care of sailors and Marines in the middle of the Pacific. So I have some experience in the adult medicine world as well. And I went to the University of South Carolina for my medical school. So again, it's really good to be here. We enjoy living in Southern Maryland. It's been really great for my family.
Awesome. Good. Well, thanks for joining us again. Let's get into the questions. So first of all, just to better understand seasonal allergies, what are they exactly?
Yeah, sure. So, seasonal allergies are very, very common. There's different names for it. Allergic rhinitis, you may hear, allergic conjunctivitis, which is when it affects your eyes. Hay fever is another commonly used term. Basically, it's just your body reacting to the different allergens, the different things that are around you in the environment. These allergens tend to start for many people in the spring, although they can be year-round. In the spring, though, we start to get the flowers and things blooming, so it's really common to start to have reactions to those. And then we tend to have the pollen starting to pick up the late spring and into the summer. Those often can peak in the summer. Grass pollens and different things like that. And then in the fall, late summer and fall, a lot of times we tend to get more into the ragweed and the different molds and things like that. So around here, that's generally what we see is reacting to these different things in the environment. Although, of course, you can have allergies to things potentially even all year round.
And so who is at risk of developing seasonal allergies? Like, is it kind of anybody can get it, or is there a certain, age group or whatever?
Yeah, so really anyone can get it, although typically we don't see very many environmental allergies in kids under 2. But depending on where you read, 10 to 30% of people can have seasonal allergies, and they often start in childhood. So it is very common. Anyone can develop allergies, whether they're in your family or not. If you do have significant seasonal allergies in your family, you might be at an increased risk for that. We do sometimes see that as well. But children certainly are susceptible to getting them too. Like I said, usually the age of 2 and up, but sometimes we will see them earlier.
So then speaking of children with seasonal allergies, sometimes, they can't always tell what's bothering them. So when should parents start looking out for allergy symptoms, and what symptoms should they look for?
Yeah, so, the classic allergy symptoms that we think about for seasonal allergies is like runny nose. It tends to be kind of a clear, kind of a thin runny nose, but not always. Congestion, so feeling really stuffy. Postnasal drip is really common. So some kids will clear their throats a lot. Parents are like, all of a sudden, they're just making these horrible noises or clearing their throats or clicking in the back of their throat or with their tongue a lot. And they're having this postnasal drip that they feel. So some kids will start clearing or ing because of that. Certainly cough can be part of that. If you have a postnasal drip, you can have that cough with it too. You can have the eye symptoms. We tend to think of the itchy, watery eyes. Sometimes they can be red. Sometimes they're just irritating. You can have some discharge, usually like a clear discharge from it. But then sometimes we see other symptoms in the kids too, especially if they can't express as much of the, how they're feeling. Sometimes they can just be really tired. Sometimes they can act a little bit more irritable. And that can be sometimes from poor sleep from the allergies, or just kind of not feeling super well with the congestion and the drainage. So you can see any of those things. Sometimes some behavioral changes, again, that tends to go along with the irritability, or if they just don't feel super great. So those are usually the biggest symptoms that we see.
And then how would a parent distinguish between allergy symptoms and something else, like, a cold or COVID? Because I know those symptoms tend to be pretty similar.
Yeah, great question. And that's always been a little bit of a challenge, especially certain times of the year when there's a lot of allergens out there. I can tell you that if you have a fever, it really shouldn't be allergies. All right. So a lot of people, in spite of the term hay fever, which is, this common way that people refer to allergies, allergies really should not cause fever. Now, again, we also need to step back and define fever really quick. So don't forget that medically, the definition of fever is 100.4, 100.4. Medically, that's the definition of fever. Anything under that is considered a normal temperature. Doesn't mean that you necessarily feel great, but we don't technically call it a fever. So if you check your kid's temperature and they're 99, that's a normal temperature. So could they be having allergies with the temperature of 99 or 99.9? Certainly, because it's not a fever. But if we're having true fevers with these symptoms, then there's something going on that's more than just allergies. If it's a really sudden onset, that's usually another red flag to me, right? Especially if it's like suddenly in the season, things have been going fine and all of a sudden, bam, you get hit, you've got congestion, runny nose, you're coughing. If it's a pretty quick onset within a day or two, the likelihood is a little less that that's probably just allergies. Allergies kind of tend to be this little bit of a gradual onset, or just kind of a little bit every day. You don't usually get body aches, chills, things like that. Not usually a lot of GI symptoms and those things with allergies as well. So if your kid is having belly pain or vomiting or having diarrhea, or again, just feels super achy and sore, a lot less likely that this is true allergies, and more likely that they've caught a virus or some other illness. One symptom that we do commonly see in allergies is also kind of dark circles underneath the eyes, kind of puffy dark circles. So sometimes parents around this time of year come in and they say, my kids just look so tired. They get these dark circles underneath their eyes. We call those allergic shiners. And it's actually, a lot of times we do see that from allergies, especially in kids. And it's the veins underneath the eyes are dilating, so they just look dark and puffier. So if you do see those under your kids' eyes, there also is a suggestion that they may be experiencing some allergies as well.
Okay, interesting. I did not know that. And then with those symptoms, how long do they typically last? I assume it's kind of different for everybody, but is there a typical, if they last longer than this amount of days, you should maybe be a little concerned, or how does that work?
Yeah, that's a little harder because, of course, it's hard to know what people are reacting to.
Right.
I can tell you a lot of things, like with the normal kind of flowering or pollinating, typical. All right. There's going to be exceptions, but kind of typically most things are going to flower or pollinate over kind of a 3 or 4 week period. Okay. So it may not be uncommon to kind of like, even for some people, if there's just 1 or 2 things they react to, have kind of a rough month with the allergies, but then they kind of go away. So it's not usually like, oh, they had couple symptoms for a couple days here, we were fine for weeks, and then we had symptoms again, although that is possible depending on your exposure to those allergens. So right. If you notice that on days when I'm outside doing yard work, or when kids are outside playing, we're having tons of symptoms, but on a normal day where we spend more time inside, we're not. Again, that really leads more toward allergies. So the timeline is a little bit difficult because some people certainly have reactions to lots of different things outside. But certainly if you're having what we'd call very severe symptoms, really horrible congestion, especially, I know we'll talk more about ways to help treat it, but that's not responding to the different treatments and it's just going on and on for weeks, certainly it would be time to talk to your physician.
Okay. And kind of getting into treatment, like you said, we'll get into that in a second. First of all, if a parent thinks their child has allergies, what would be the next steps for them to take?
So if it seems like it's the pretty typical itchy, watery eyes or the clear drip, especially if you find that symptoms are worse when you are outside or as the weather's getting nicer and spending more time outdoors. It is fine to try the over-the-counter medications first in the vast majority of time. So there are a lot of over-the-counter medications that are available that you don't need prescriptions for because they're generally considered very safe. And so usually, especially if it's a young child, we'll say, go and pick up some, cetirizine or, like the Zyrtec or Claritin, of course, those are the name brands, but the generic brands are perfectly fine. And give those a try. And those are actually approved from ages 6 months and up for allergy symptoms. Although, like I said, we don't typically see them that young, but it's possible. They don't usually give the dosing for that young, so you might need to talk to your doctor before that dosing. But it is usually fine to try some of the over-the-counter antihistamines. Now, as a word of that, we usually do recommend that you go for the daily antihistamines, the ones like Zyrtec, Claritin, Allegra, Xyzal, the ones that do last for 24 hours. There's really no benefit to grabbing Benadryl or some of the older ones, the diphenhydramine necessarily. Those are kind of the first line antihistamines. They don't last as long. They're usually more in that 6 to 8 hour window, and they do tend to be more sedating. So it's perfectly fine to try one of the ones that you only have to take every 24 hours. They generally are less sedating, and they can be very effective if it is true allergies. So it is fine to try those medications for at least a handful of days to see if you have improvement in those symptoms.
Okay, thank you. I'm going to take a second, and if you're just now joining us, thank you for tuning in. Spring is right around the corner, and we'll be eager to get outside and enjoy the longer, warmer days. But for many children, this may bring on symptoms of seasonal allergies. These symptoms can be unpleasant and challenging to manage. So today I'm joined by pediatrician Dr. Bethany Gad to talk about seasonal allergies. And we've been identifying seasonal allergy symptoms, not only in children, but in all ages, and discussing warning signs that they may need medical care. We have more to talk about, so stick around. Give us a like to let us know you're watching. And if you have any questions for Dr. God, you can ask them in the comments below. And speaking of questions, we do have one from one of our viewers, Mary. She asked, could allergies cause me to lose my voice?
So they certainly can. So if you're having a lot of postnasal drip, it certainly is possible. Anytime you're having a lot of drainage down the back of your throat, it certainly can cause some irritation around your vocal cords. So with a significant amount of drainage back there, you could, I probably tend to see more of that kind of hoarse, kind of hoarse voice more than totally losing your voice. It certainly can affect your voice if you're having a lot of postnasal drip. So that is definitely possible.
All right, thank you. And thank you for your question. So my next question for you is, does it help to continue to expose your child to the allergen in hopes they will outgrow the allergy long term?
Great question. So the reality is, unfortunately, that the longer we are alive and exposed to different allergens, actually, the more likely you are to develop allergies to them. So that actually means that as children get older, as adults, just if you reach adulthood and don't have any seasonal allergies, unfortunately, it doesn't mean that you're safe, that you're never going to develop seasonal allergies. So anytime that you're living around these allergens, you can become sensitized to them over time. So it's not one of those things that we say, definitely expose your child repeatedly in hopes that it gets better over time. Some people do see that. It seems like maybe they have more allergy symptoms when they're younger and less when they're older, although there may be other factors in play, what those allergens truly are, and if they're actually no longer exposed to as many as they used to. But I do want to say this, it is also having a kid with allergies or anyone with allergies, it's also not a reason to stop your normal living and function. So for example, for kiddos who have allergies, we don't want to pull them out of recess. We don't want to keep them locked up in their house all the time. So our goal is actually to manage your symptoms so that you can do your normal life and your normal function. So while we say exposing them is not necessarily going to make it better over time, it doesn't mean that we completely remove them from those exposures. We can talk, I think we'll talk later about some practical things you can do to reduce your allergen exposure, but we still want kids to be kids and we still want people to get outside and we want you to still enjoy being out there. It's then just managing those symptoms so that you're able to do that.
So then, like you said, that goes into my next two questions. First, what tips can you offer parents to help manage their child's allergy?
Yeah. So when we're talking about the symptoms themselves, again, the antihistamines, like the, Zyrtec, Claritin, those are great ones that you can just get over the counter and that you can try. There are also the nasal sprays. So there's a few different nasal sprays out there. The glucocorticoid nasal sprays, ones like Flonase and fluticasone, are actually considered first line for many people for allergy symptom treatment. These are sprays and you're putting right in the nose, which is right where most of the people have their biggest symptoms. It kind of helps block all that from as you're breathing it in anyway. It reduces the inflammation in your nose and can really help a lot of people's symptoms. So especially when we're getting to kids 2 and up, because these sprays are approved from kids 2 and up, that people actually probably need to use the nasal sprays like Flonase, fluticasone even more. So they're probably underutilized. For many allergists and ENTs, it's one of their first line treatments. But here's the thing to remember about those. It takes several days for those to start working. They don't work instantly because of how they work in their body. So you usually have to use them for, I tell folks, 4 or 5 days, maybe even a week before you start to see significant improvement. So it's not a nasal spray that you use once or twice and you say, well, that didn't work and I'm going to stop it. So especially if you know that spring is a rough season for you or fall is or whatever, you can start using that nasal spray. Depending on your age, it's 1 or 2 sprays per nostril per day. You can start using that nasal spray consistently. And most people after 5 or 7 days see significant symptom improvement to the point that many people don't even have to take the oral medication. So that is definitely a good option as well for kids who are 2 and up, in addition to the non-sedating oral antihistamines. So for actual treatments, that's a good one. Now, there are other treatments that can be prescribed by your doctor, or some different regimens that, you could probably describe, and I know we'll talk about that more too, but things that if you're trying the regular over-the-counters like the oral antihistamines and the nasal sprays and you're just not seeing good improvement, then we should discuss some other options further.
Okay. Yep. That is going to be my question after this one. But first, what changes can parents make to reduce allergy symptoms?
Yeah.
I guess maybe besides like the medicine, like you said, is there environmental changes or anything that you need to add?
Absolutely. And those are really key because we still want our kids to be kids, right? And as adults too, get outside, enjoy Southern Maryland and get out and do all the things, or, wherever you live. But we want to make sure that we are trying to reduce the excessive exposures that are able. So ways that you can do that. If it's in the middle of your bad season, as much as we love the beautiful weather, don't leave your doors and windows open, right? So try to keep that stuff outside as much as possible. Change your air filters, right? All of those typical things. After you've been outside or your child has been outside, playing outside or whatever, when they come in, certainly at least before bed, have them shower, bathe, or at least rinse off. Because a lot of those allergens you're going to pick up, they're going to be on your clothes, they're going to be on your skin, they're going to be in your hair. And so if you go to bed not having showered or rinsed those off, now they're sleeping on a pillow covered in all of their allergens that they're allergic to. And so that certainly can irritate that as well. So shower or rinse off at least at night before bed. That can help, again, relieve some of that burden. Washing the sheets and pillowcases and all that stuff, as often as you can, practically, again, to keep those allergens away. Vacuuming your carpets or sweeping as often as you can, just to remove those allergens. If you have a pet that's an outdoor pet, a lot of people don't think about this, or a pet that goes outside, they're bringing all that stuff in with them too. So make sure you are bathing your pets frequently, and making sure that they're getting all that stuff removed. And even if it's a beloved pet, maybe not have that pet sleep in your child's bed, or maybe keep them out of your child's room during that high allergy season, or out of your room, because again, they're bringing all that wonderful allergy stuff, all that pollen or whatever, into your bed or into your room. They're laying up against you at night, and that again can cause more of those symptoms. So even those sort of things can help reduce the extra allergen exposure that you may have in your home.
I did not even think about that, the pets bringing it in. So that's a great point to make. And so, like I said, my next question, or what are some other treatment options that I guess, you can discuss with your doctor to help with your allergies?
Yeah, so there are some prescription medications for allergies. And so usually we'll say if you're trying your over-the-counter stuff, right? You're trying your nasal sprays and you're trying your oral antihistamines, and you're just not getting good symptom relief, or if you have a lot of additional eye symptoms, for example, or things like that, please go see your primary care provider, because there are other things that can be prescribed, like mometasone and again, some different prescription drops and things like that. if for people who have very severe allergies, then we will sometimes send you to an allergist. And that's because sometimes if we're doing everything we can, some people might actually need allergy shots, which is how we desensitize you to those things in the environment. So that's usually kind of we've maxed out on all of our kind of normal treatments. And then we say, all right, you need to go see an allergist so they can, find out if they need to do something, especially like allergy shots as the next step. So certainly if you're going through all of your normal routine and symptoms are just not getting better, you have the chronic congestion and you're just miserable, or your child is, please come to see us, see your doctor, and talk about if there's anything else that we can add, or if we do feel like you need to be seen by an allergist.
So I think that kind of touched on my next question a little bit. What signs should a parent be aware of that may require taking their child to seek medical care? Can you talk about that a little bit more?
Yeah, sure. So like I mentioned a little bit before, fever is a big one. And again, you don't have to take your child to the doctor necessarily every single time they get fever, but I'm not going to be able to say that a fever is caused by allergies. And if you do have chronic congestion from allergies, it does set you up for things like ear infections and sinus infections and things like that. So certainly if your child's symptoms are worsening, if they all of a sudden start to complain of terrible ear pain, or they have a fever, or they're just having thick, nasty discharge that you're doing everything that you can, and it's just constant and they're miserable, then yes, they should be seen. Come on in. We can make sure you don't have a bacterial infection. Again, there's a lot of other viruses running around there too. We're still seeing a lot of flu. So, we could also, the symptoms seem bigger than what you would expect for allergies. We can do all those normal screens and evaluations as well. Those really are the big ones, again, are just really poor response to the normal regimen that we do. Occasionally someone has, especially when we'll see the little kids have big adenoids or something like that, in which case we might end up sending you to ENT if you're just chronically congested. But so all that stuff, we have a lot of options out there. So if you are doing all of your normal things and you're like, this just still seems excessive, my kiddo's miserable, or I'm miserable, or can't sleep because of the horrible congestion or something like that, please see your primary care provider and let us see what else we can do for you.
Great, thank you. We have a couple questions from our viewers. First one from Mary: can children become immune to allergy medicine?
Great question. Okay, so there's a phenomenon called tachyphylaxis where anyone can actually, if you're taking one of the oral antihistamines, and you're taking it regularly, like daily for 6 or 9 months or longer, your body actually does become kind of desensitized to that allergy medication temporarily. And so what you would need to do then is switch to another one. So it can be switching from Zyrtec to Claritin or vice versa. And then after you've been off that medication for several months, you will be, again, like sensitized to it again, and you can use it again in the future. So for most people who have seasonal allergies and they only take allergy medications a few months of the year, or they have it for a few months, then they take a break and then they use it for a few months more. It's not a phenomenon that most people experience, but for people who have these kind of long-term allergies where maybe 9 months of the year you're having symptoms, you might find that after a while you do become, it seems like your medicine's just not working anymore, in which case, yes, switch to another one and see if that is helpful. And again, after several months, you could always switch back. I have some families who have year-round allergies, and just every 6 months or so, they just rotate to a different one, so make that less likely. And some people do find that certain allergy medications work better for them. Of course, they're all in the same family, but absolutely, there are some people too who say, I tried this one, it didn't really work. This one worked great for me. So if you do find that what you're on doesn't seem super helpful, make sure you're taking the right dose, you and your child. And then it is perfectly fine to try another one.
Great, thank you. Next one is from Sherna. They say their baby is 5 months old and believe they've been seeing allergy symptoms since like a few weeks. She mentioned sneezing, the under eye darkness that we talked about, that comes and goes. She said she brought this to his pediatrician, but was told it was unlikely to be allergies. So she's asking, what else can I do or say when bringing him back in for his 6-month appointment?
I actually really agree with your pediatrician. The likelihood of a seasonal allergy at this age is extremely unlikely. It is totally normal for babies to sneeze. So I usually tell folks from the beginning, they have no other way to control their normal mucus in the nose. We sniff, wipe, or blow normally without even batting an eye at it. We don't even think about it. Newborns cannot do that. So they sneeze, and they sneeze all the time. So they don't sneeze because they're allergic. Under 6 months, it's really too early, especially starting at a few weeks, too early for allergies, as far as seasonal allergies. Now, are there other potential household allergies or things like that? Rare, but not impossible. So there's other things that can cause dark circles under the eyes, can also be just genetic, hereditary. Some people just always have them. So, I would certainly not worry about a young infant who sneezes a lot as far as with allergies and for just dark circles. It would just be taking all the other things into account. But it is true that especially under 6 months of age, environmental allergies would be extremely, extremely unusual.
Okay, thank you. Our next question is from Amanda. Does saline or humidifiers help?
It sure can with like your congestion. And so, the reasons that we'll recommend saline sometimes is just because it helps loosen all the stuff and lets it run out easier. So it's not going to treat the allergy per se. But if you get a lot of congestion and it just feels like it's all socked in there, absolutely. You can use saline sprays, the nasal or the sinus rinses. That's also great, right? The ones that you use the saline packets, make sure you're using the right water. You don't want to cause any infectious concerns, but that you can absolutely use saline rinses, nose rinses, because it does just kind of help the stuff to break up and run out easier so you don't feel as congested. And the humidifier really does the same thing. So it just makes it so it's easier for the stuff to run out. A lot of people sleep more comfortably if they have a humidifier by their bed. So it's a perfectly fine and appropriate measure to use in addition, but it's not going to be miraculous for controlling your actual allergies if you're having really significant symptoms, but it certainly can be helpful.
Good to know. Thank you. Next one's from Cassandra. She has a two-part question. The first part we kind of just touched on earlier. What is the appropriate path to take when someone has taken all the recommended antihistamines, nasal sprays, etc., and none of those medications provide relief? And then the second part is it appropriate to take those medications on a regular basis when you have allergies throughout the entire year?
Yeah, great question. So if you're doing everything over the counter, everything you've tried, and you're like, it's just not working, you need to see your regular doctor or your primary care provider, because we want to make sure that that's what it is, right? And there are other things out there. Sometimes big adenoids can cause that, or there's other things that can cause it. And there are prescription allergy medications that are there too. And if you're already on one of those, then usually our next step would be to refer to an allergist, because sometimes people just need allergy shots. If we're doing everything else, we're throwing everything else at you. Some people just have such bad allergies that it's so much more beneficial for them to get allergy shots, and they have such a great improvement in their symptoms. So again, if you're trying everything, first stop is your regular PCP, and then from there, they can decide if you need referral to anywhere else, like ear, nose, and throat, or to an allergist. And then the other question was, I'm sorry, I forgot the second.
Is it appropriate to take those medications on a regular basis when you have allergies throughout the year?
Year round. So in the vast majority of cases, yes, especially the over-the-counter medications can be taken year round. Like we mentioned, you might find some desensitization to some of the oral antihistamines. If you take them every single day year round, you might need to switch it up occasionally, but there's not usually safety concerns, especially the antihistamines. The antihistamines are pretty benign and safe. As far as like using the nasal steroid regularly, in the majority of the time, yes. If you have questions specifically about that, talk to your doctor about it, or if you have any other sort of health concerns that you think might be a risk for that. But for the majority of people, it is perfectly fine to take allergy medicines year round if you have to. And if you can give yourself breaks, even if it's 3 or 4 weeks in the middle of the winter when something's, better, then do it. But usually it is okay to take your medicines long term.
Okay, great. Thank you. Another question from Cassandra. How should reoccurring sinus infections at least 4 to 5 times a year be handled?
So it all depends on the cause, right? So if the cause is allergies, again, then we might need to be talking about an allergist to control your allergies if you're doing everything else. If it's otherwise, like allergies are under pretty good control, but I still just get these, then it might need to be a discussion with your primary care provider about talking to ENT to make sure that your sinuses are normal, that your adenoids are normal, and that there's not something else that they recommend that needs to be done. So I think it's kind of a two-part, answer, as far as it really kind of comes down to what is our problem. Is the problem the allergies, or is the problem maybe our anatomy? So talking with your primary care provider about potentially either or both of those referrals could be very helpful.
Great, thank you. And last one is from Jean. She says, I used to suffer from tonsillitis a lot as a child growing up. Could this have been an allergy?
So tonsillitis itself, usually means sore throat, right? Or inflammation of the tonsils. Potentially, right? So certainly you can get some sore throat. We don't usually see horrible sore throat as a major symptom of allergy. It tends to be postnasal drip. So you can, of course, have irritated throat. More people talk about like it's irritated, I'm constantly clearing it, or it's really tickly. Could you have some sore throat with it? Sure, but not usually like true tonsillitis, where when I look at someone's tonsil, they're huge and they're red and they're inflamed. Not usually from allergies for that. So that tends to be viral. Of course, there is the bacterial option of like strep, but just the typical tonsillitis that we see tends to be viral or sometimes bacterial, not usually allergy related in itself.
Okay, thank you. And thank you all for your questions. My last question for you, Dr. Gad, is what message would you like our viewers to take away after joining us for this broadcast?
Yeah, sure. So allergies are super common, especially for many of us here in Maryland. And it is fine to try some of your over-the-counter remedies. Again, I would reach for our longer acting, our daily antihistamines, or the nasal steroid first, because those are considered first-line treatments. And then all the allergy avoidance like we talked about. So you can still live your life. Again, that's the goal. Still live your life, do your activities, enjoy all the things you want to do, but yet not be miserable. So do all of those things. And if you're miserable or your child is miserable, please go see your primary care provider to see what else we can do for you.
Perfect. Well, that's a great way to wrap up our broadcast. Thank you again to our viewers for tuning in and asking your questions, and to Dr. Gad for joining us and answering our questions. To schedule an appointment or learn more about Dr. Gad, you can check out the links that we'll be posting in the comments below. Thank you for tuning in, and we'll see you next time.